I'm Peter Whitfield. I'm a consultant neurosurgeon at University Hospitals Plymouth, and as a neurosurgeon I look after a lot of patients with serious head injuries and brain hemorrhages and high-risk operations, and as a result I've appeared in the coroner's court on a number of occasions over a long period of time. When I'm asked to attend an inquest, usually I'm expecting that to occur because I've already given a witness statement in relation to the care of a patient that's been under the care of myself or my team. So I get a written request normally from the legal department in the hospital. I then prepare a witness statement, and usually it's many weeks, 2 or 3 months later, that I actually get asked to attend court. When I get the request to provide a statement, I feel it's important to do the job properly and thoroughly, and therefore make sure I have all the records available and the scans available. And I go through the notes quite carefully, preparing a statement. I try to make the statement fairly concise, telling the story of what happened to the patient and using information, particularly in my specialty, related to scans and the timing of events, so that the coroner can appreciate the story of events as they happened. When I'm asked to be a witness in the coroner's court, the main people who might be able to advise on that process are really the hospital legal department, and certainly if the patient, the deceased patient, is their family are being represented by a barrister, the hospital will be aware of that and they will provide legal support. In my experience, that's actually really uncommon. When you're preparing a statement, the legal department will give you a template for the statement, and that will have about 8 or 9 paragraph headings. So usually the statement starts off with your full name and what your occupation is and how long you've been doing it. And then the statement, then you should retell the story of what happened in a chronological order. And I think it's important in that statement to try and use clear English to explain medical terms so that the coroner isn't baffled by medicine. Some of them are medics, but most of them are lawyers without a medical degree. Be very clear in your statement. I think it's important that you stay within your area of your contact with the patient. If you're a more senior doctor as a consultant, you may have to give an overview of care provided by your team, including your juniors. And I think it is reasonable to explain where there's a range of opinion on doing an investigation or how important that investigation is, and explaining your opinion and what you believe the thinking to be. It's really important to realise that any statements that you make, your signature is at the bottom of them, so they're statements of truth. In that statement, I always put a short section, 1 or 2 sentences offering my condolences to the family, because I'm sure the family will get to see the statement if they wish to. And I think be careful, reread it, don't think it's job done, press send, read it through carefully and make sure you're happy with all the content. If there's any areas you're not clear on, I think it would be worthwhile stating that in your statement. For a junior doctor preparing a statement, it would be wise, and certainly my juniors have shown me statements they've prepared. What's so wise to show your statement to your consultant or a more senior doctor to see if they feel that that is an appropriate statement. When I'm preparing for a hearing at the coroner's court, I review my previously written statement quite carefully to remind myself of the case. I get hold of the medical notes. I had in my earlier appearance, one of my earlier appearances, assumed the notes would be in court, and they weren't. So make sure you've got access to the medical notes. And it may be that your hospital legal department will be taking the notes to court, particularly if more than one witness from the hospital is providing evidence. I look at scans, and in fact I have printed out pictures of scans to help explain things in court as well. If you're called to the coroner's court and this is your first time, so you've never seen a coroner's court, I think it's well worth speaking to the legal department in the hospital, so they will know the local setup of how the court looks and works. Definitely read through your witness statement and reference notes and scans so that you're well prepared when you go to court. When you get to court, if you've not been before, have a look round, and usually the coroner's officer will let you have a look into the courtroom and will explain who will be sitting where. And take all that in. Try and keep calm. It's not a court where the coroner's trying to find anyone guilty of doing anything wrong. The coroner's trying to find out how the patient died. Act professionally, dress professionally, and be clear. Talk about things that you know to be true, and try and avoid speculation and stick to the facts. I think it's really important when you're presenting evidence in the court to talk in clear English. I always look at both the coroner and the family members to try and get non-verbal feedback from both of them. When you're talking about medical matters, try and put them into plain English speak, and try and be sure that people are understanding what you're talking about. I think be open to questions. So if questions challenge what you're saying, don't be rigid in your opinions. Be prepared to change your opinions in the light of the circumstances. You are only one piece of the jigsaw, and it's not until you're in court that you will have seen the other pieces of the jigsaw. When you're called to the coroner's court and you're attending as a witness, there's always a concern that did something go wrong, and might this lead to a clinical negligence claim? If the patient's family are being represented with a legal representative, which might be a barrister, I think there's a high chance that the family have grave concerns about the quality of care, and that they may well be using evidence that's presented in the coroner's court to try and help inform their side of the case, and that might lead to clinical negligence. I can't personally think of a case where that has actually happened, where I've been in the coroner's court, where a clinical negligence case has followed. But I think it's a very legitimate concern that doctors may have, and I think that's why it's so important to be very thorough in delivering your evidence and sticking to the facts, being truthful, and also being accepting that there may be a range of opinions on how an action's been taken. As a doctor, we are all members of indemnity organisations, Medical Defence Union, etc. And I think it is quite wise to seek advice from them, particularly if you've got any concerns about the care that you provided. There's no harm at all in contacting the medical defence societies, and they will almost certainly advise you to write your report and almost certainly offer to read it through. I think when doctors go to the coroner's court, they can feel like they're on trial themselves. They shouldn't feel like that. The coroner's not looking to apportion blame on a given doctor. The coroner may be looking for systems to try and improve care in the future, and the coroner may be issuing a report to your hospital chief executive on how systems of care can be changed in the future.